Welcome to Virginia Eye Consultants. Since 1963, our mission has been to develop with our colleagues in optometry, ophthalmology, and medicine, enduring patient relationships, providing clinical excellence and state-of-the-art surgical eye care in a world-class facility. We are honored that you have selected us. Your great vision starts at Virginia Eye Consultants.
Hello, I am Dr. Thomas Joly, one of the surgeons here at Virginia Eye Consultants. I specialize in oculoplastic surgery. You are seeing me today in order to consider eyelid surgery to improve the position of the upper eyelids. Oftentimes, the upper lids will droop over the eyes to the point where vision is blocked in the upper visual fields. Even if vision is not significantly blocked, the appearance of the lids is something that you may want to improve. When I evaluate a patient for eyelid surgery, I'm generally looking at three potential solutions. The first is the position of the eyebrows. The second is the position of the eyelids themselves. And the third is the sagging of the skin in between the two. For some patients, lifting the brows takes a good amount of weight off of the eyelids and produces an excellent result in increasing the eye opening. For these patients, there are several choices for brow lifting. One option is to make an incision along the hairline and tighten the entire forehead, thereby lifting the brows. This surgery works well if the patient has a hairline that can hide the incision line. However, this is not an option for everyone, and even when possible, many patients prefer less surgery. A second option is a direct brow lift. In this surgery, a smaller incision is made just above the brow to tighten the skin of the forehead. This gives an excellent lift to the brow and is one of the strongest, longest-lasting procedures we have. It does have the downside of having a visible incision line at the upper edge of the brow. But this incision line fades with time and often can be designed to be fairly inapparent. A third way to lift the brow is to make the incision within the crease of the eyelid. This is a much better hidden incision, which is essentially invisible with the eyes open. With this incision, I can move up under the brow from beneath and place an anchor in the sub-brow tissue to take the weight off of the eyelid. This procedure has the advantage of a much smaller incision, and it does not produce a dramatic lift of the brow itself. It is a very good procedure for patients who do not need or want a lot of additional height to the brow, but simply need the weight taken off of the lids from under the brow. The anchor used is something like the peg that holds your shelves in your kitchen cabinets. One side of it goes into the bone of the forehead, and the other end holds the deep tissue of the brow up in place while it heals in this position. These tissues need only a week or two to heal into place in order to remain in this elevated position. The anchor itself dissolves within 3 to 4 months. Shortly after the surgery, you may feel some bumpiness to the deep tissue of the brows caused by the anchor, but this fades with time as the anchor dissolves. One side effect of brow lifting that I can tell all my patients about is the likelihood of some numbness to the skin of the forehead for a while after surgery. The nerve that supplies the feeling to our forehead travels through the brows and may be damaged or cut during a brow lift. The sensation returns to the forehead either in the short term, in a few weeks after the surgery as the nerve recovers, or in the longer term, taking several months after surgery if the nerve is cut and needs to regrow. Most patients who have had a good brow lift agree that some numbness to the skin is an acceptable side effect if this happens. It does not affect your ability to move your brows, but simply affects the sensation of the skin. In many cases, the brows are in a good position and do not need to be adjusted. The issue is mainly the extra skin hanging down from the brows onto the lids. In this case, a simple blepharoplasty will give an excellent result. This is an easy surgery to recover from, as the skin is very thin and heals quickly. I make an incision in the crease of the eyelid and remove a crescent of skin above the crease. If there is any fat pushing forward causing bulges in the eyelid, I smooth this and then close the skin incision. One common concern of patients is that they have heard that the surgery can be overdone and they could have trouble closing their eyes after a blepharoplasty. This is possible, and I need to be careful to make sure that I do not overdo the surgery and tighten the skin too much. But as an eye doctor first, I am aware of this and make careful measurements for surgery to avoid this complication. Having performed several hundred blepharoplasties, I am well experienced in achieving an excellent result for my patients. In some cases, the lid itself is drooping, a condition known as eyelid ptosis. In most cases, this is because the muscle that lifts the lid has stretched at its attachment to the eyelid. I can correct this by making the same incision that I would use for a blepharoplasty, and simply put a suture in the muscle tendon to tighten it, and therefore allow the lid to sit at a higher level. I do this surgery after giving a numbing shot to the eyelid so that the surgery is not painful. After the numbing shot, the patient gradually awakens from the sedative, and once I have the suture in, I have the patient sit up and look up, down, open and close the eyes to judge whether I have gotten the two eyelids even. In some cases, ptosis surgery can be done from the back side of the eyelid with no skin incision at all, if no skin needs to be removed. In these cases, the healing can be quicker with less swelling and bruising, with no visible scar. Any of these surgeries are done as an outpatient procedure. They generally take about an hour to perform, and the patient goes home the same day. Most people do not even bother with a pain pill after surgery. Pain is not so much the issue as the swelling. I have all my patients use cold compresses for 2 days after the surgery to keep swelling to a minimum. It's also a good idea to sleep elevated, such as in a recliner, to keep the swelling down the first couple of nights after surgery. I usually see my patient back about a week after surgery to take the sutures out and to examine the results of the surgery. In most cases, I can judge the effect at this point. Sometimes, swelling and bruising is still significant, and I may ask the patient to come back a month later to judge the final effect. Now, there can always be complications from any surgery, although these are rare with eyelid surgery. Complications such as an infection, excess scarring, or the incision opening can usually be dealt with if they occur without affecting the final outcome of the surgery. While there is always the possibility with any surgery near the eyes that a complication could damage an eye or the patient's vision, I have never had this tragic result happen with any of my patients, and I hope to have my whole career pass without such an event. 9 times out of 10, when I see a patient back after surgery, the result is just right, and both I and the patient are very pleased with the result. I can be somewhat picky, and 1 time out of 10, I may suggest to a patient that there is something that I can improve on. Maybe a little more skin taken here, or a little difference in the shape of the eyelids that I could improve. Oftentimes, when I suggest such a touch-up, the patient tells me that it is not even something that they are concerned with. As I said, 9 times out of 10, the surgery turns out beautifully without any adjustment. I do a lot of eyelid surgery, as it is my specialty and it's what I do full-time. And generally, my patients are very happy with the results. Often, a patient would like to know whether their insurance will pay for their eyelid surgery. Most insurance companies will give a predetermination of whether you qualify for this surgery according to their criteria. We will perform the necessary testing today, including taking photographs and performing a visual field test, as well as taking measurements of your eyelids, which your insurance company requires to make this determination. Although I do not know what each insurance company's criteria are, you will be meeting a surgical counselor today who will check with your insurance company to see whether you qualify under their criteria. Often, when a patient are planning an upper eyelid surgery, they are also considering having an improvement made to the lower lids as well. The lower eyelids can have either bulges of fat pads from behind or sagging of the skin on the surface, both of which can be improved through surgery. If you are interested in this procedure, I will discuss with you whether a surgery from the back surface of the eyelid to smooth the fat pads or from the front surface to tighten the skin would be best for you. This is not a procedure that is covered by insurance and is therefore an additional out-of-pocket expense for the patient. Many of my patients choose this option, feeling that if they are going to go through the healing process for their upper lids, they would like to have the lower lids improved at the same time. I hope that I have helped answer some of the questions you might have about eyelid surgery. I look forward to discussing the options that will be best for you and to having you join the hundreds of patients for whom I have done my best to improve the function and appearance of their eyes.